morning. We'll be talking about an old female who came to us with recurrent chalazion INC done outside and how we managed it. So, sebaceous cell carcinoma for India, it's the most common tumor, most commonly seen in the upper lid, most commonly involving the lateral canthus. And whenever you see an elderly patient with recurrent chalazion 2 or 3 times operated, the first thing you think of is sebaceous cell carcinoma. And that's why you always biopsy a chalazion. So let's see what happens. So a 75-year-old female with a recurrent swelling as seen on the right outer aspect of the upper lid since 8 months, undergone 2 episodes of incision curettage. She has history of bleeding from the lesion, painless progressive increase, loss of lashes, and she had no other signs of involvement of the orbit extraocular muscles or systemic involvement, lymph node involvement. Her general physical examination was normal. Lymph node examination showed no enlargement in any of the groups in the neck. Now the ophthalmic examination, as you can see, there's a 10 mm in the horizontal and 7 mm in the vertical dimension mass on the right upper lid extending into the posterior lamella, that is the conjunctival side. There are dilated vessels seen on the lesion. It's a yellowish firm lesion with areas of necrosis, hemorrhage, and it is involving the lateral canthus as can be seen from the lateral view. And on eversion, there was the mass infiltrating up to 8 mm from the gray line on the conjunctival side. The visual acuity, it was logma 0. The movements were normal. There was a pterygium and a non-significant finding for this patient. The posterior segment was normal. So we made a provisional diagnosis of a right upper lid sebaceous cell carcinoma involving the lateral canthus. We planned for an excision biopsy with a map dot biopsy. Mets workup was negative. We did a wide margin excision biopsy with a 12-point map dot biopsy. And the microscopy, it showed, as you can see, nuclear atypia with peripheral palisading of cells as seen in image A. And in the image B, you can see the red arrow is pointing the mucocutaneous junction, and the black shows the cell nests just in the subconjunctival space, involving the tarsus and the meibomian glands. The image D, it shows a characteristic separation artifact. So all of these findings, they were suggestive of a basal cell carcinoma involving the tarsus and the posterior lamella of infiltrating variety. So the AJCC classification came to T2C N0 M0. The tumor was surgically resectable. So we went for a full thickness resection, and it left a 16 by 10 mm defect involving the lateral canthus. So we reconstructed the posterior. So here we can see the defect. We raised a tensile flap. In the second image, the green arrow shows the periosteal flap to reconstruct the posterior lamella. We rotated the tensile flap to reconstruct the anterior lamella, and the lateral canthus was reconstructed by fashioning a tarsal strip out of the lower lid and anchoring it to the periosteal flap. So this is our 18 months follow-up. The lateral canthal angle is maintained. There is mild ptosis, but the patient is happy with the cosmesis. There is no recurrence. So basal cell carcinoma, though it's the most common eyelid malignancy in the world, in India it's the second most common, and squamous cell and melanoma still have to catch up. And the classical features of basal cell carcinoma, usually on the lower lid, it's a infiltrating rodent ulcer, indolent for years together. Whereas this patient, she had a 9-month history with a globular mass on the upper lid with a yellowish lesion. So this was a masquerade basal cell carcinoma as a sebaceous cell carcinoma. Now the poor prognosis, she had one of them that was involving the tarsal plate and conjunctiva, but after complete resection for 18 months, she has had no recurrence. So always biopsy a sebaceous cell carcinoma or a chalazion, a mimicking sebaceous cell carcinoma. Thank you.
Thank you, Dr. Shalin. It was a very good case. As you pointed out, biopsy actually is very important, right?
Yes.
Good.